main objective for today is biomedical engineering training, and we are going to be discussing on two sub-objectives for today. So we are going, first of all, we're going to hear the February result of the preventive and corrective maintenance visits around the SS2020 hospitals in Mara region by the Musoma Biomedical Engineering team. And also we are going to hear a didactic presentation on the troubleshooting for the electrosurgical unit. So those are going to be our main points for discussion today. As usual, we'll begin with introduction of participants. And then we are going to have a 20-minute quality improvement case presentation from Musoma. The biomedical engineer are going to take us through the results of the preventive and corrective maintenance visit of February around the hospitals in Mara region. After the quality improvement case presentation, we are going to have 5 minutes for questions for those who are going to like to ask questions to the BMETs. And then we are going to now have a didactic presentation on troubleshooting for the electrosurgical unit, which is going to be led by Das Gunalan, who is a biomedical engineer from Assist International. And at the end, we are going to have a discussion, comments, recommendations concerning the objectives, and then we are going to have a conclusion. So I would like to welcome you all to begin the session. Perhaps I will begin by introductions because I think we have enough time. Just welcome the Musoma Biomedical Engineering team to introduce themselves. Please, our colleagues from Musoma, please introduce yourselves, and then we are going to go on.
Oh, thank you so much. My name is Dessication. I'm the head of biomedical department in Musoma, and today we are going to do a presentation to you, a good one. Here is my team. You guys can introduce yourself.
Hi, I'm Emmanuel Francis, a biomedical technician here in Musoma.
Hi, I'm Gladys Peter, biomedical technician in Musoma.
Hello, Bartholomew Ndegea, biomedical technician. So,
I'm Aaron Maofu, biomedical technician in Musoma.
My name is Yamusa Juma, biomedical engineering.
So that's the team of Musoma. So today we are going to do the presentation to you.
Thank you. Sorry, I would like to interrupt just to finish the introduction from the other BMETs. I think we also have a BMET from Tarime and from Bukoba as well. Please introduce yourselves and then we are going to go on.
Hello, I'm Avelia Skubia, biomedical technician from Bukoba Regional Hospital.
Wale wa Musoma pale. Tarime Hospital also we have a biomedical technician. I think you can introduce yourself. Make sure your microphone is unmuted so that we can hear you. Okay. Tarime, I think you are unmuted.
Good evening.
Good evening to you.
This is Anita Gora from Tarime, a biomed from Tarime. You're welcome.
Thank you, Anita. Please welcome. So we are going to begin the first, oh, I forgot. Please, Guna, please also introduce yourself. This is the biomedical engineer from Assist.
Hi, I'm Gunalan from Assist International. So I'm a biomedical engineer as well. So I'll be talking about preventive maintenance and troubleshooting on electrosurgical later on. Thank you.
Okay, thank you, Guna. So we are going to begin with the quality improvement case presentation from Musoma. I think Benedict and your team, if you are ready, you can begin the presentation.
Thank you. Hello, Kevin. Hello, can you see our presentation?
We can see the presentation, but I think the sound is not very clear. If you can move closer to the microphone. Okay.
Prepared for you. It is called Plan Preventive Maintenance for February to the 5 hospitals which are in Musoma. So I wanted you to see the report of Plan Preventive Maintenance for those hospitals. And the case is Electrosurgical unit. The case start based on Musoma Hospital, the Center Hospital, Mara, and Manyama Hospital, Nyerere DDH, Tarime DDH, as well as
Sorry, Benedict,
Shilati.
I have to interrupt a bit. Can we all hear? Tunawote tunamsikia presenter vizuri?
Sauti haiko vizuri.
Sauti haiko vizuri.
Okay.
Okay, I'll repeat.
Try to stop your video. Stop your video and then continue. Maybe it will improve the connectivity.
Stop sharing. Stop video. Okay. So our case start of today is Plan Preventive Maintenance for Electrosurgical unit. And the case start based on Musoma Center Hospital of Mara, Manyama Hospital,
okay,
Nyerere DDH, Tarime, and as well as Shilati District Hospital. So we have two presenters today, Benedict and Mr. Emmanuel. So we'll be doing the sharing when we do the presentation. So these are the contents, and I'll allow my fellow to proceed. These are the contents.
Okay, Benedict.
First, we have the introduction. Yes.
Still, the audio is not very clear. I was wondering what microphone are you using there?
Okay. What about now? Am I? Do you hear me clearly?
Now it's better. Yeah.
Now it's better.
Yeah. Okay. Go
okay. On. So I will go ahead. So we have the introduction to the electrosurgical unit. No. ESU, the diastema machine, objective of the analyzer, which used to analyze the diastema machines. So we have in the physical check for ESU and ESU electrosurgical check, ESU performance test, as well as conclusion. So I welcome my fellow to proceed with the presentation.
Okay, thank you. As Mr. Ben has introduced there, we did maintenance for preventive maintenance for 3 main equipment. That was for RRIs and the other main machines, that is electrosurgical, and we did also for operating beds. As we move on, now we have introduced the contents that we shall have during this presentation. We start with electrosurgical unit. Electrosurgical unit is a device used to cut a part of human tissue and reduce an escape of blood during surgery.
Sorry, you are.
An ESU.
We still cannot hear you properly. We are trying to find out what the problem is. Are you using one microphone? Maybe you can switch on to the other microphone.
No, we just use laptop here.
We're just using a laptop.
Kevin, I would love to interfere. We're having a small issue with our Dessication, but we're trying to fix the problem.
Okay. Maybe you can just continue, but move closer to the microphone.
How about now?
Okay, continue, and we'll see.
Okay. So during the preventive maintenance trip for the February, we did it for three mentioned devices. But here we're gonna explain for just one, that is ESU Electrosurgical unit. As we have said, Electrosurgical unit is a device used to cut a part of human tissues and reduce an escape of blood during surgery. An ESU is a generator capable of producing a cutting and a coagulating clinical effect on tissue by the use of alternating current in the range of 100 kilohertz to several megahertz, that is RF, radio frequency, also known as the radio surgery. Voltages and currents may vary depending on the desired clinical effect. Principle of operation. Here we're going to discuss about the principle of operation of ESU as our case study we have chosen. Electrosurgery uses alternating current. The patient is included in the circuit and the current enters the patient body. This is for monopolar. Electrosurgical generator is the source of electron flow and voltage. As we continue, the other name for ESU is diathermy. That means dia means through and the thermal means temperature heating. Here we can see there are two pictures that are showing a photo for our diathermy machine, ESU, electrosurgical one. That is one, and that also is a part of those. It's just a screen showing the powers for monopolar and for cutting and coag. And these ones, we have got a plate here. We have got electrodes, and we have got those pens for cutting effect. Objective of ESU PPM. We do preventive maintenances, and there are so many objectives of doing these PPMs. As when we do this one, the following are the objectives of analyzing ESU is safe, accurate, and ready for patient use. When we are measuring this, we are measuring output powers. We are we are just trying to ensure ESU is safe and accurate, ready for patient use. Also, we do make these PPMs preventive maintenances to make performance verification. That we have to know that the equipment is performing in our qualifications, or it's performing under qualification. So we just have to know during when we make a PPM. It makes us knowing the performance verification. Also, you can see it tests ESU with ESU analyzers with the associated checklists. As we can see, we have got checklists that we can notice ahead there as we move on. We have checklists. So those checklists, we are using them to determine and to see the ranges, as those checklists are for standard international checklists. You can see ahead. Primary preventive maintenance during the triple. The following are the procedures followed during the PPM of electrosurgical unit. We as biomedical engineers, we have our procedures to follow during this preventive maintenance. And we did follow these all procedures during all maintenance trip we did for those 4 centers that include Manyamanyama, Tarime, Shirati, and Nyerere. The first one we did for those ESUs, we did physical inspection. As you can see, physical inspection involves of many things, including cleanness and things like that. Also, we did it for electrical safety check by use of electrical safety analyzer. We have got a very modern electrical safety analyzer. Here we used it doing this electrical safety checking. Also, we did the performance test. We have got a ESU analyzer, so we are using it for verifying performance. Also, when we continue, you can see here, this one is electrosurgical, is the electrical safety analyzer. Electrical safety analyzer, this analyzes for electrical safety. So during the maintenance, we do electrical safety checking that the equipment is behaving on our checklist for this one, for electrical safety, that our equipment is behaving good or not. So when you do this electrical safety, we do perform and we see we need to do this in order to take out shocks and things like that. So during this, we verify our equipment in electrical safety. Also, you can see in ESU analyzer. This one is a one that is used to test a performance. A performance, that means that when a doctor is setting maybe a 300 cutting effect, that we need to produce a 300 cutting effect. So this one is going to act like a patient to show us that that power we have set is the one that we are getting out. So this one can display, as you can see that display, when we set it and we take it as a patient. So we put there our pen and the cutting and see the power as displayed. You can see here. So when we set, we see the power displayed here. So that we determine that our ESU is good or not during this ESU analyzer.
So
ESU physical inspection. We can start with this physical inspection. Of course, during our trip, we did the solos of physical inspection because we had so many ESU analyzer, ESU machines. You can see physical inspection involves checking of all physical condition of the unit. Like the first one, we check for unit housing and casing, cables and cable connectors, display and alarm, labels, cleanness, and so on. Here you can see during our trip, we did this was just a cleanness. We started with the cleanness and was cleaned and following all procedures for physical inspection checklist. When you're moving on with physical inspection checklist, you can see our checklist there. That is a very, very modern checklist. As you can see, we are using it. The first one, you can see the chassis housing. If you can zoom in, you can see all the things there. So you can see there is a fuse, we can check for fuse, we can check for mounting, we can check for AC plug, we can check for pump, we can check for everything physically. So we can continue.
But before we continue, sorry, I would love to interrupt. We want to do a small zoom in so you can see, at least they can see what is within the checklist.
So now you can see, as from the above, we have so many things there to judge during our maintenance. For physical inspection, there is chassis and housing there, you can see, and we have got mount and fastener, we've got cast and brakes, and AC plug, line cord, strain relief, fuse, cables, fitting and connectors, pumps, and control or switches, indicator, display, alarm, levers, and battery. So all these ones are used to check during physical inspection, but are varying according to an equipment. So an equipment, some equipment cannot have pump. For example, we have our equipment that is the ESU is not having pump. So
Heron,
that is not.
Sorry to interrupt you. You can also, unaweza pia ukaelezea kwa Kiswahili kama ukipenda.
Okay.
At some points kama unahisi unataka kuelezea zaidi unaweza ukaongea kwa Kiswahili pia.
Okay.
Yeah.
So now we're having those control switch and all things we have seen there. We can go.
Labda nichangie hapo maana tuko pamoja. Hii form ni physical inspection. Ni form ambayo tunaitumia kuangalia kifaa kwa nje muonekano wake. Endapo kifaa kitapita kwenye hii form hakitakiwi kutumika. Ni form ambayo tunaiangalia, ni moja ya form, tuna form 3 kama alivyoelezea mwenzangu ambazo tunatumia kufanya PPM. Ni lazima mashine ipite kwenye hizi form zote 3.
Yaani kwenye hivi vigezo.
Yeah, vigezo.
Na hivyo vigezo venyewe ndo kama mnavyoviona hapo, kuna plug, kuna zile waya za umeme, kuna hizo pampu, kuna hizo cables ambazo ni waya, afu kuna hizi labels ambazo ni labels za kawaida tunazoziona kwenye mashine zetu. Tuna hizo control switches, tuna switch zile ambazo mnawashia mashine na kuzimia mashine. Tuna indicator ambazo zinatumika katika kuonyesha kwamba kifaa chetu labda kinaleta alarm na vitu vingine kama hivyo. Na hapa chini tukiangalia kuna label, tukiangalia kuna battery. Kwa hiyo ile battery tunaipima, tunaangalia na vitu vingine kama hivyo. Lakini kama nilivyosema, hii form itatumika according to kifaa. Yaani kuna vifaa vingine unakuta kuna vitu havitumiki. So utakuwa unaweka not applicable au utakuwa unaweka not applicable kama kifaa hicho hakitumiki sehemu hiyo kwenye form. Let's go. Now we move on. Now it's English now. Electrical safety check. Now we are going for electrical safety check. Electrical safety check is a main important condition in all medical and non-medical equipment due to the hazards that can be caused by electric current. The main hazard is electric shock. As we can see, electrical shocks have been experienced in many hospitals. So doing this electrical safety check can improve our electrical safety. Electric shock is a current passing through human body, and it can cause minor and major injury, even death. Kwa mfano, short ya umeme inaweza ikasababisha mtu hata akapata majeraha au hata wakati mwingine ikasababisha kifo. We can move on. When we continue, electrical safety analyzer is used to test and check if the unit is working under its specific standard of all manufacturers specification. So this one is used to test if the equipment is working under specific standard. That standard we are having in electrical safety checklist. So we are using those checklists to check for those electrical safety. The following is tested by using the analyzer. So during this test, we are doing this test as follows. we are checking mains voltage. As you can see, tunaangalia voltage ambayo inatumika katika kifaa hicho. Kifaa inatumia voltage gani? Inaingiza voltage gani? In English we call it input voltage to the device. So we check for device current, we check for earth resistance, and we check for earth ground leakage current during our electrical safety analyzing. As you can see, this is the picture. This is the one of the ESU unit that we used to, we checked. As you can see there, we were on our performance and we did it, and it did well. So you can see here in our form. You can see the checklist for electrical safety. Now it's having main voltage. You can see main voltage is 200, and you can see device current, you can see ground of wire, insulation test, you can see everything like this, enclosure leakage currents, patient leakage current. So everything is there. So this is the checklist we are using to test for electrical safety checking.
Sorry, I would love to interrupt what is being discussed here. So these are the parameters you can see. Kwa ESU ambao tuliipima, kuna measurement ambazo tumezifanya ziko hapa, na utaona tolerance ambayo inatakiwa iwe kwenye limit gani. So ukiangalia hapa tulizipima, alafu unaona iko kwenye tolerance. Kwa mashine ambayo tuliipima, unaweza ukaona ili pass kwa sababu iko within the tolerance. Ndio kitu ambacho anakielezea mwenzangu. Hii ni checklist ya pili. Ya kwanza tumesema ni physical inspection, hii ya pili tunapima umeme wa mashine. Na checklist yake ni hiyo hapo kwa kutumia hiyo device yetu ambayo tunayo BMET Msoma hapa. So hizi ndio zilikuwa measurement kama mnaweza mkaona. Hii ni current, device current, unaweza kaona ni 0.07. No, device current here 0.07 ili pass. Kitu kingine ukija kwenye leakage ni 8 microamperes, unakuta iko chini, iko kwenye range. Kwa hiyo kwa machine tulioipima ili pass kwa kufuata hii checklist. Tunaweza tukaenda.
Okay, thank you for that. You can see not only those we have said about those two testing. The first one was physical and the second one was electrical safety checking. So now we are going to performance test checking. We did also performance test checking for all the ESUs found on those 4 hospitals. We can see Electrosurgical unit ESU.
Aaron, I would like to interrupt you a bit. For the sake of time, maybe you can take us a bit quicker.
Yeah, sure.
Yeah, okay.
Okay. Analyzer is used to check the performance of monopolar and bipolar ESU in power output are within range. The tolerances of plus or minus 20%, such as cutting power outputs, coagulation power output, liquid. Tunadiletisha na hii tolerance yetu hapa ambayo ni plus au minus 20%. So ikiwa ndani ya hii inakuwa kifaa chetu kimefanyaje? Kimepass. You can see this was one of the picture, one of the center we did it for power output test, and you can see it passed it. RF leakage test. Hii inatumika kuangalia leakage za RF ili kuweza kulinda watumiaji wa kile kifaa. Kwa hiyo hii inatakiwa iwe ndani ya range ya 150 mA. Hii range ya 150 mA inakuwa haiwezi kumhamu mtu yote mtumiaji wa kifaa. So under this, ukiona kifaa chako kiko chini ya hiyo, basi kinakuwa kimepasi. Na vifaa vyote ambavyo tumevipitia kule katika hospitali hizo 4 zote tulizopita vimepasi na vimeobey the law. Asante.
Hii ni checklist ya performance. Ni checklist ya performance ya device yetu moja. Mnaweza mkaona, tunatamani kuwaonesha hivi ili mjue tunachokifanya. muone na devices zetu ziko kwenye uwezo gani. Okay. So unaweza kaona hii ni kwa Monopolar, kwenye upande wa cut unaweza kaona measured values ndo zilizopimwa, alafu unaweza kaona range iko vipi. Kwa jinsi tulivyopita kwa mashine zetu za diathermy tumekuta ziko kiasi kikubwa sana, ziko vizuri sana. Kifupi ndio hivyo.
Thank you. When we continue during the trip, in 4 hospitals that we mentioned, that is Manyamanyama and etc. All preventive maintenances were completed, and all tests, including physical inspection, electrical safety, and performance testing, passed. Hence, all electrosurgical machines for these 4 centers are safe for use. Conclusion. Now, as we go to conclusion, ESU analyzer should be properly applied so as to ensure safe surgeries. This test should be performed by trained biomedical engineer or technician during, after installation, during planned preventive maintenances, and after repair or corrective maintenances. All these tests should be done. Thank you so much.
Asante Kevin, tumefikia mwisho wa presentation yetu, lakini na sisi zaidi tunakukazia PPM. Tunataka tukazie kabisa, tukumbushane, ni jambo la msingi sana kwenye upande wa vifaa tiba, kwa sababu kwa mashine kama za diathermy zina historia pia ya kuchoma watu. Kwenye watu wako kwenye procedure inaunguza mtu kama itakuwa well monitored. Na monitoring ambazo tunataka hospitali zetu zijue ni za kufanya PPM kwa kufuata hizo njia zetu 3 na checklist zetu 3 hizo. Ya kwanza ya physical inspection, ya pili ni ya kupima umeme, ya tatu ni ya kupima performance, kwamba mashine ifanye kazi kutokana na manufacturer au ile design ambayo ilitakiwa ifanye kazi. So chief, nitaka nikazie hayo, watu wakumbuke lazima PPM zifanywe na tufanye kwa kuzingatia hizo procedure 3 ambazo zimependekezwa na Assistant International na ambazo timu zetu zinatembea kwenye mahospitali. Asante.
Okay. Asante sana Benedict with your team from Musoma. Tunashukuru kwa presentation nzuri. Kwa wale wenye maswali kwa timu ya Musoma ya BMET, kama kuna mtu mwenye swali lolote angependa kuwauliza, anakaribishwa. Au unaweza pia ukaandika swali lako kwenye chat alafu tukalijadili baadaye wakati wa majadiliano. Na mimi pia nadhani nilikuwa na swali kwa BMET, perhaps unaweza wakaendelea kulifikiria. Of course hapa kwenye presentation yenu mlisema kwamba mtatupa general report ya field visit yenu ya mwezi February kwenye zile Safe Surgery 2020 Hospital in Mara region. Naona sana mmebase kwenye PPM ya Electrosurgical unit. Nilikuwa tunataka nijue kama kuna vifaa vingine ambavyo vya hospitali ambao mlifanyia. Sorry, we apologize, we had a network problem. But I was asking the Musoma BMET team if there are any other medical equipment or medical devices that they did a preventive maintenance during their February trip apart from the electrosurgical unit. So that was my question to them. Sijui kama kuna mtu mwingine mwenye swali kwa BMET. Okay, I see Upuge Health Center Tabora, karibuni. Okay, sorry again for the network problems. I think tuna shida ya network hapa Bugando. Kwa hiyo ndo maana nadhani tunakatika most of the time.
Sawa. Tunaomba swali ulilouliza tujalisikia vizuri.
Okay, sawa. Nilikuwa nimeuliza kuhusiana na visit yenu ya February kama kuna vifaa medical devices zingine zote ambazo mlifanyia PPM apart from hiyo electrosurgical unit ambao mmepresent. Kwa hiyo nadhani tutalijadili baadaye mwishoni wakati wa majadiliano. Upuge Health Center Tabora, naona kuna mtu amenyosha mkono. Karibuni muulize swali.
Asante. Hello?
Tunakusikia, endelea. Tunasubiri uulize swali kama ulikuwa na swali.
Hello. Na swali langu ni kwa
Naona network yako sio nzuri, hatukusikii vizuri.
Tunayo diaphragm lakini ina takriban kama miezi karibia miezi 6. Tukitaka kuanza kazi lazima nishirikishe yote.
Nadhani hatujakusikia vizuri.
Swali ni kwamba
ndio.
Naam, swali ni kwamba tuna diaphragm machine lakini ina muda kidogo hatujafanyia kazi. Takriban kama ni miezi 6 hivi iliyopita. Je, kama tutakapoanza tena kuifanyia kazi itahitaji PPM maintenance ama mpaka itakapoisha?
Okay. Sawa, tunashukuru sana. Asante kwa swali lako. Tutalijadili wakati wa majadiliano. So, Guna, I would like to welcome you for the didactic presentation. We are now going to start our presentation. If you are ready, you can proceed.
Yeah, I'm ready. Okay, let me share the screen first. All right. Can you guys see this?
Yes, we can see it.
Okay, let me make it big. Okay, so I'm going to talk about electrosurgical unit still, but on PM and troubleshooting all this. Okay, so when you talk about electrosurgical, everyone know about Electrocautery. It's before the electrosurgical generation. They got Electrocautery and Electrosurgical, two different devices actually. When you talk about cautery, it's about direct current, DC source, and it's a limited space. Basically, only particular organ and tissue are targeted to do some during the surgery. Okay. And for electrosurgical, you are talking about high frequency current flowing through the active electrode, basically using AC source, but higher frequency. Normal AC source is 50 Hertz, but you are talking about more than 100 kilohertz or 500 kilohertz, depends on the type of electrosurgical unit you are using. So they got a written part through respective electrode, and patient is basically included in the circuit. You can see the picture showing patient with the active electrode and the passive electrodes are returning back to the system. So the principle is basically when you talk about direct and alternative, direct current is used by electrocautery and alternating current is used by electrosurgical. So this basic concept, normally you're going to see in OR, how they use electrosurgical unit with a patient plate and active electrode, active monopolar or bipolar stuff that going to make one circuit included with the patient and the ground line, all that. So this is the concept that very important when you talk about electrosurgical unit. You need to know about your grounding system in your OR room, operation theater. If your grounding is not good, there'll be some issues that you have to consider about your grounding. I'll show you what can cause trouble, what type of trouble yet that you're going to see. Okay, when you talk about monopolar, monopolar is basically the second photo. Bipolar is the first one, is using a scrap, something that you do it on the, basically you're covering small area only. So whatever power that you use is going to go back at that particular same area. But when you talk about monopolar, it's basically it's a one big circuit. So your body will be the impedance, all that. So three most important components that you're going to see in electrosurgical is active electrode, dispersive electrode, then electrosurgical, then very important is the foot switch, all that. So when you talk about patient return electrode, there's so many. That is, they got single use, they got a multiple use type of patient return electrode. And for the active electrode, the monopolar switch, the end switch, the tip can be needle tips, blade tips, and ball tips. Anyhow, guys, if you got any question, you can stop me. I can answer your questions on certain part of it, or we can do it after the presentation. Okay, so when you talk about working principle, you're talking about active electrode, high current concentration, that going to go through the pencil of the monopolar, and the depressive electrode is basically low current, heat dissipation. So basically it's going to go through your body line. Basically is going to go through the patient return electrode. So the current concentration density depends on the size of the area which the current will flow through. Okay. So waveform. So when you talk about electrosurgical, you're going to see pure cut, blend, dissation, and flagellation. So each of these modes, they got their own waveform. So when you talk about pure cut, it's going to use low level voltage. Blend, the voltage will be higher. Dissation and flagellation will be much more higher. But the pure cut, that will be 100% on. When you press cut, the performance will be on all the way. Blend, you're going to get 50% on, 50% off. You can see the frequency graph, that on and off sequence is there. When blend, 40% off and 60%, 40% on, 60% off. And blend 3, like 25% on and 75% off. So how the respond with this pure cut, blend, all this, you can see the example. When you talk about pure cut, you see it's just a cut. It doesn't have much of the white layer. So blend, there's a white layer reaction. That means it cut at the same time, it tried to reduce the bleeding. Flagellation and non-contact coagulation, you're going to see the dark area, all that. So it's going to cut, and it's flagellation, normally it try to stop the bleeding, all that. Example, there you go. You can see sometimes the bleeding area, you want to stop bleeding, you need to use dissection or coagulation method. So they use coagulation or this type of thing to stop the bleeding. Same as Goyas, you can see the pattern. So these are used to stop bleeding actually. So when you talk about grounded electrosurgical, so the disadvantage with this particular electrosurgical, nowadays you're not going to see much grounded but electrosurgical system. But what happens is when your electrosurgical is not going to perform properly, or your grounding system is not good, and your radio frequency leakage is very high. So what happens is, if you got ECG electrodes, the electrosurgical unit patient plate is not attached properly, or the single-use patient plate may be broken or something like that, is going to find a different part of ground line. So the ECG can be one of the point that it can pass through, or the bed itself. So for example, your OR table. Your OR table is grounded, and your ground of OR table is much more lower than your ESU ground, is going to find that part. So basically, these are risks for the patient actually. Example of pad site burn. So you can see what happened to the patient leg. So these are due to the grounding issue, all that. So when you talk about preventive maintenance, normally when you start, you need to know what tests you're going to do, basically electrical safety, all this, and performance test, visual inspection, all that. So basically you're going to do visual inspection, protective earth resistant, leakage current. The reason you do protective earth resistant, one of the main reason is you want to make sure that the leakage on the RF leakage or anything should go through your plug point grounding. So you're going to do all these insulation resistant tests. It depends. You not necessarily have to do every time. Functional tests and reporting of the results, evaluation, and check and prepare for normal use. These are common things that you're going to do during a preventive maintenance. So during preventive maintenance, when you talk about preventive maintenance, first thing you're going to do, physical check of the device condition. I think earlier Musoma did mention all this, but we're going to repeat again. Inspection of diffractive electrode. So you're talking about the patient return electrodes. You have to check, because most of the time that I see what happened is the cables are broken, and sometimes it still function, but it's not going to function properly. Then the operating foot switch and return electrode physical condition. So these are on the physical part. When you talk about performance, electrical safety, you're going to do electrical safety, first of all. So electrical safety, basically you're going to look into user safety, patient safety, and the equipment, whether it got any leakage or not. Then you got return electrode monitoring. Basically, you're going to perform the return electrode performance. You want to check whether it's really working well with the device or not. Then output power from maximum output. Then radio frequency leakage. So all these are very important. When you talk about radio frequency, high frequency, you're going to do a leakage current testing, especially on the monopolar. Because if your leakage current is too high, you're going to affect the patient actually. So, oops, give me a second. Okay, there's two checklists here. One is electrical safety, another one is performance test. But I didn't include the physical check of it because earlier I think Musoma did show that, so I didn't include that particular part. So normally you have to do physical check, electrical safety, and performance tests. These are very commonly done most of the countries as a biomedical engineer. So this is your proof that the machine is working fine and ready to use by the user in the hospital. So best practice for ESU performance testing, always refer to the manufacturer service manual if you have one. If you don't have, you follow the international standard. Add up a consistent inspection frequent. So basically ESU, if you do a performance maybe in 1 year twice, it depends. If the machine is always been used, always have issue, you can do it 3 months once. Depends on how you want to do your frequent inspection plan. So add up a formal standardized test procedure. So you can standardize the procedure for all the equipment. Pair additional test equipment with your electrosurgical analyzer. So you want to compare the testing if you have one. So if you have a 2 electrosurgical analyzer, you can compare the results. If not, it's not necessary. Okay, be mindful of the test lead while testing. So basically, just check with the cables, put it in a nice way, and test it properly. Always exercise caution when dealing with active electrode. Remember, electrosurgical unit are quite dangerous, so you need to make sure you do it in a proper way and safety first, because it can really cut someone when you do the work. So be careful. If you're using a ring, please, wedding ring or whatever, please remove it from your finger, because sometimes when you touch, it can cut your fingers actually. Just be careful. Okay, perform all the tests necessary to ensure it performs the performance. Okay, and always keep a copy of results for record so you can refer them in future. Okay, the circuit diagram is very straightforward. RF generator is basically the unit and active electrode and the body and patient electrode. These are monopolar circuit. This is how it works. Okay, your body work as an impedance and it go through the patient electron. General block diagram. Okay, when you talk about block diagram, I always break up audio generator, front panel, LED, foot switch, and main control CPU unit, logic control, board relay, power operation or RF board, and patient return electrode, power supply, isolation transformer, and RF output. So when you talk about audio tone generator, is basically whatever connection error or any wrong connection or broken cable from the patient electrode is going to give indication there. Front panel is basically going to give you a lot of information, your power setting, all that. Normally it'll be LED display or LCD display, depends on the brand. Okay, foot switch, normally you got cut and coagulate on the foot switch. And main CPU is basically going to take all the information and going to give you output, all that. Okay, when you talk about power operation or RF board, these are basically where the frequency is generated and the amplifier circuit are designed. Okay, all the amplifier circuit to amplify the voltage, high voltage, the chopping, all is done here. Basically, it's going to take your power supply input of 50 Hertz is going to generate 500 kilohertz, all that. Patient return electrode is basically when the electrode fail is going to send signal to the main CPU and going to give a audio generator. And logic control and board relay, control board and relay board, basically these are controlling all the high voltage relays. So it's going to, when you press the cut, it's going to on and off with a high voltage relay. Isolation transformer, basically it try to reduce the leakage of your system. So they use an isolation transformer. So that's the only thing so far. And anyone got any question? I think I did quite fast actually. Hello.
Yeah, thanks, Gunnar. We were with you. We have seen each point. And we as technical team here, we have taken notes to most of the discussed.
Anyone else?
Gunnar, thanks a lot for your presentation. We are going to welcome questions from the participants regarding your presentation.
Yep, sure.
I know we have another two BMETs who have joined the session. We have Anita from Tarime and Evelius from Bukoba. Perhaps you have some questions you would like to ask Gunnar regarding the didactic. Evelius,
For me, for today, I don't have a question to ask. Later, maybe Anita from Tarime.
great.
Thank you for the nice presentation. It was very understood. Thank you.
Welcome.
Okay, thank you. Thank you so much, Anita and Evelius. I would like to hear from you, Anita, what do you think of the, what are your comments regarding the Musoma team presentation of their visits in February? Perhaps we can begin with that. If you have any questions to them or there's anything you would like to know.
Yes, we can hear you.
Okay. From Musoma team, thank you for your nice presentation. Okay, I think we've gained a lot on physical and electrical performance, and I think you could take some notes to distribute to nurses who work in theaters, because this lectures was very beneficial to them. That's my opinion.
Thank you.
Unmute. Okay, Anita, you wanted a clarification from Musoma or you just gave a comment?
No, just give a comment.
Okay. Okay, thank you so much. So perhaps I would like to re-ask my question to the BMET team from Musoma. You've said that you're going to give us the general report for your February visit, and you mentioned specifically on the electrosurgical unit. I just wanted to know if there are any other medical devices that you assessed during your visit.
Okay, Kevin, we want to do a small share. We want to share the report for February. Actually, we are doing PPM and corrective maintenance to 5 hospitals which are in Musoma each month. So in Mara, we want them to be aware of that. And our plan is that we want those trips and the report to be shared in this meeting, so the hospitals may know the equipment which they have and what we have to do together. So you can see now, this is the report for February.
Of course, we did a PPM for 3 main things, many devices in the theater. That was operating beds. That was and the operating lights, as you can see there. And we did it for operating beds and diaphragm. So 3 main devices we did it for. We did it for beds, electrosurgical units, and ORA lights. And the report was good actually, as you can see. Yeah, only for those 3.
So Kevin, we had the 3 items as mentioned: electrical bed, surgical lights, as well as the last one.
Okay, thank you a lot Benedict for that, for sharing with us. Sijui kama kuna mtu mwingine yote mwenye swali kwa BMET au kuhusiana na electrosurgical unit au diathermy. Participant mwingine yote mwenye swali?
Naomba kuchangia kidogo Kevin, samahani hujaniruhusu.
Karibu Ben.
Asante. Kuna swali liliulizwa hatukujibu la yule mwenzetu ambaye alikuwa anataka kujua je ni wanaweza wakatumia mashine hiyo ya diathermy kwa kuwa ilikuwa chini kwa miezi 6. Hilo swali alikujibiwa, lakini kwa majibu ambayo naweza nikampa ni haya hapa. Kisheria haitakiwi umtibie mgonjwa kitu chochote ambacho hakina hauna uhakika nao kijathibitishwa. Kisheria imekaa hivyo. Na pia kwa sisi kama biomedical engineers kwa diathermy machine ni lazima ifanyiwe ppm. Kama mla mafundi wako hapo ni kwa miezi 3, kila baada ya miezi 3. Lakini ni so far kama mafundi wako mbali basi ni kwa miezi 6. Kwa hiyo ameuliza swali zuri, nimependa. Ni mtazamo mzuri sana, mimi nimeupenda kwa kweli. Ni mzuri sana. Kwa hiyo hawataki kuitumia hiyo mashine mpaka ifanyiwe ppm, iangaliwe ina operate kwenye vigezo vinavyostahili. Hilo la kwanza. Lakini la pili, sijui nitakuwa nimetoka mbali sana. Nilikuwa nataka kwa hizi hospitali zetu, nimetamani kweli hichi kitu Kagera na Mara tuhakikishe kabisa matengenezo yote ya vifaa tiba yanafuata hizo nguzo 3. Hizo nguzo 3 jamani ni nguzo za kidunia kwa sasa hivi kwa vifaa tiba ambavyo vinamtibu mtu. Kwa sisi walivyoleta tulipokea kwetu kama Musoma na pia tukaja kuielewa na tumeendelea kuielewa zaidi sasa hivi. Ndio dunia iko hapo kwenye vifaa tiba. Kwa fundi yote anayekuja kutengeneza vifaa iwe ni sisi wa Assist International au Musoma, basi sisi kama hospitali mbili iwe ndio basement yetu ya kuhakikisha ufundi umefanyika kwa kuangalia hizo criteria 3: physical inspection, electrical test hiyo na performance, kwamba hakikisha amefanya ndani ya hizo criteria 3. Jamani, Kagera na Musoma, hizo ndio technical basement zetu sisi. Nilitaka kukazia hichi kitu Kevin, ili tuhakikishe kabisa tuko kwenye hiyo platform ambayo imetutofautisha. Jamani, mimi natamani kuongea kweli leo. Wizara imetambua Musoma, Mara na Kagera hichi kitu tunachokifanya. Na nimekuwa nao, nazungumza nao sana na sasa hivi tuko nao. Wanatambua hichi tunachokifanya juu ya matengenezo ya vifaa wenzangu, kwamba sasa hapo ambapo ni pazuri tulipo tukae hapo tu base kwenye hivyo vitu. Kevin, hayo tu ndugu yangu.
Sawa. Asante sana Ben kwa contribution yako nzuri. Na perhaps we have some of the hospitals who you are saving including but before that, kabla ya hapo ningependa niwakaribishe wenzetu wale wa Upuge Health Center Tabora kama wana swali la ziada. Na swali lao la kwanza limejibiwa, kama watakuwa na swali la ziada.
Asante. Hello.
Yes, tunawasikia.
Na tushukuru kwa ajili ya majibu mazuri ambayo yameyasema. Lakini pia tuna shida kidogo kuhusiana na kama BIOMEDICAL, tunapata shida kidogo kuhusiana na jinsi gani ya kuweza kuendelea kuoperate katika vifaa ambavyo ni vizuri zaidi na ambavyo viko katika ubora mzuri kuhusiana na kuoperate tena. Kwa swala langu tu, labda ombi langu kubwa, je, tunawezaje basi kupata access ya medical engineering ambao tunaweza tukafanya nao kazi na tunaweza tukapata contact zao ambazo sisi kwetu inaweza kutuboreshia huduma zaidi kwa ajili ya kuweza kufanya maintenance ya vifaa.
Nashukuru sana kwa swali lako zuri sana. Sijui kama kuna, so the question, maybe to repeat it in English, our colleagues from Upuge Health Center want to know how can they contact these biomedical technicians, because it seems like they don't have access to biomedical technicians in their facility. So I wonder if BMET team from Musoma, you have something to contribute.
Yes, Kevin, we have. What we can advise. They can contact Assist International.
Benedict, are you still there? We cannot hear you. Hatukusikii vizuri.
Kevin, is that light?
Yes, now we can hear you. Endelea sasa. Tunakusikia.
Yeah, what I wanted to advise them, because the BMET for Mala and Kagera are under Assist International, so it's the good approach for them to contact Assist International, and Assist International can know what to do. It's easier for this activity. They just have to contact Assist International. I mean the head of technical activities in Assist International.
Okay. Okay, thank you. Asante sana Ben. Sijui kama kuna idea nyingine au wazo lingine ambao tunaweza tukapendekeza kwa colleagues wetu walioko Tabora. I don't know. Anita from Tarime, do you want to speak something?
Okay. Mimi ningependa kushauri kwamba
Anita, umekuwa muted. Hebu jaribu ku unmute. Hatukusikii tena.
unasikia? Hello?
Ndio, tunakusikia, endelea.
Ningependa kumshauri kwamba hapo Tabora mkoani kuna mainjinia watatu wa biomedical, lakini pia kuna injinia wa nzege wa biomedical. Kwa atafute eneo ambalo ni la karibu na hapo, anapeleka fomu kwamba nahitaji mtaalamu wa tiba, alafu baada hapo anafuata taratibu zinazofuata. Asante.
Okay, asante sana Anita, nafikiri ni response pia nzuri sana. Sijui kama una swali lingine. Okay.
Kevin, ushauri hapo.
Tunashukuru sana. Okay, asante sana. Benny from Msoma, naona ulikuwa na swali. Ni comment.
Yeah, nilikuwa natamani kushauri kwa sababu hiyo mashine tunatakiwa tuipime performance test, sio matengenezo. Na kwa taarifa fupi ambayo ninayo na ndogo ni kwamba hivi vifaa vya kutestia mashine viko kwenye hospitali kwa Tanzania kama 4. Kuna Kagera, Musoma na kuna Muhimbili, na hospitali nyingine ni kuna Bugando na Tumbi. Kwa hiyo au wenzetu ambao Anita amewapresent ni jambo zuri, lakini hawana hizo test equipment. So that's why naendelea tena kurudia kule ili sasa tupate yale tunayoyataka. Ange consult hizo hospitali ambazo labda zina watu wenye test equipment, au kwa hiyo suggestion ambayo ni fupi, kama tuko pamoja katika timu hii, basi tu consult Assist International ambao pia wana vifaa hivyo, na kwa haraka zaidi wanaweza wakapata huduma.
Okay, asante sana Benny. Evelius, karibu na wewe kwa ajili ya contribute.
Mimi ndo nilichotaka kuchukua ambacho tayari Benedict ameongea, kwa sababu ikitokea hiyo mashine ikaharibika, baada ya kufanya matengenezo lazima ufanye hizo test zote, performance na yani test zote tatu hizo lazima uzifanye baada ya kuwa umefanyia matengenezo. Sasa kwa watu walio Tabora hawana hivyo vifaa vya kufanyia hizo test. Kwa ni vyema wakati wana consult watafute hospitali ambazo zina vifaa hivyo ili waweze kufanya kazi vizuri. Yeah.
Okay, asante sana Evelius. Okay, sijui kama kuna comment nyingine in regard to presentation ya leo au swali. Okay, kama hamna swali, si ni labda niwakaribishe Biaramlo DDH. Dr. Hakim, kuna swali lolote?
Hatuna swali, asante.
Okay, asante. Tunashukuru. Basi nadhani Guna, we are about to reach the end of the session today. I don't know if there's anything you wanted to add upon our objectives. Anything you would like to ask?
I'm not really. I don't have any question, but it went quite well actually for Musoma, all that. But I think there's less of questions. Other than that, it's good.
Okay.
Yeah, sure.
So encouraged to ask more questions and make the discussion a bit lively.
Yes, please.
Yeah. Okay. I think so that will be a take-home message during the next BMET session. Just prepare a lot of discussion points and questions so that we can learn more and more from these sessions, especially to the biomedical engineers who join this session. It will be very good to have a lot of questions and discussions so that we can gain a lot. Okay, after saying that, we have reached the end of the session for today. Thank you all for joining. We are going to continue next week. So we are going to have another BMET Echo session, I think, on next month on April. So thank you all for joining, and then see you on the next BMET session.
Yep, karibu.
Thank you.
Thank you so much.
See you.
Asante Guna.
See you.
Ero kamano.
Asanteni sana.
Asante.
Baba.
Tuandike.